Hello everybody and welcome back. My name is Eunice Mathis. I'm a registered nurse and the owner of Florida Training Academy. In this video, I'm going to be showing you how to feed a resident. And don't forget that, monitoring your patient's fluid and food intake is so important. It helps to prevent malnourishment. It also helps to prevent dehydration. And so at the end of the skill, don't forget to document. And of course, as with every skill, I've already washed my hands. I've provided privacy. I've provided privacy. I've put on gloves. I've explained the procedure to our patients. And now I'm going to get our patient in the safest position for someone who's going to be fed. I'm going to get him upright to a high Fowler's position. Is it okay if I change your position now? And Patrick is a wonderful patient actor. If anyone in Florida is looking to hire this wonderful actor, I will make sure that I have the contact information for you. And of course, right now, yes, he's giving Jesus vibes. I know it. All right, so now that I have my supplies on my table, I'm going to go ahead and put a towel on his chest in order to protect his clothing. For the Florida Certified Nursing Assistant Examination, you always want to offer the person an opportunity to wash their hands before feeding. And the reason why you want to make sure the resident's hands are clean is because in real life, your patient may either reach up and touch you, or they're going to try to assist and touch their food and they're going to contaminate it. So Patrick, half of the washcloth is wet, the other half is dry. Would you go ahead and cleanse your hands for me? And then flip and you can dry your hands with the other half. You would now take this and put it in the laundry basket. During the Florida CNA examination, you will have two different food choices. Patrick, is it okay if we feed you applesauce today? And the song or mnemonic that I made here at Florida Training Academy is hands, water, 3 bites, water, wipe. Go ahead and repeat that with me. Hands, water, 3 bites, water, and then wipe. If you can do those 5 steps, you're going to pass the CNA examination. So I've already washed Patrick's hands. Now I'm going to give him water in order to wet his mouth. The way I like to think about it is if you are giving a patient something to eat. Let's say it's a biscuit and they're just waking up, they have a biscuit with their breakfast tray and they're on oxygen, or if they're on a medication that can dry the mouth. If you just give them a biscuit without giving them water first, it's going to make it really hard for them to swallow. So we're going to help Patrick by giving him water before we give him food. Everything went down okay? Now we're going to feed our resident using a spoon. However, we're not going to overfill the spoon. We're only going to put half of the applesauce. We're only going to put half a spoonful of applesauce on the spoon, and we have strawberry applesauce, which is your favorite. Okay, can you open up for me? Very good. We're going to repeat that 2 more times. Enough. Awesome. And then this is the last bite that we have to provide for the state of Florida CNA examination. Good. All right, so let's go back to our song. Hands, water, how many bites? 3 bites, making sure you check the mouth after each bite. And we want to make sure that the food really gets down. So we're going to provide water next. Here's some more water. Everything went down okay? For the state of Florida exam, you cannot leave anything wet. So we just gave our resident water. We want to make sure we dry his mouth and his beard. We're almost done. Hands, water, 3 bites, water, wipe. I want you to think about a person who's depressed, especially depression in the elderly. If an elderly person does not want to live, how would they help to ensure that they are not with us much longer? I don't want to say how would they commit suicide, but the way that a person would die in your nursing home is by refusing to eat. And so after you feed someone their 3 bites of food, you want to ask them if they want more. Of course, in the real world, you feed them as much of the food as they want. My rule of thumb is if my patients don't eat 50% or more of 2 meals, I want you to go ahead and notify that nurse, because we can contact the doctor, we can get supplements ordered, we can help that person get the nourishment that they need, even if they may not want to eat it. We can use other mechanical devices to ensure that they're getting the nutrients. So hands, water, 3 bites, water, wipe. Would you like more to eat? Would you try another bite for me? Just one more bite? Okay, very good. Here we go. Did it go down okay? And here's some more water to wash it down. All right. I'm so proud of you, Mr. Patrick. Wipe your mouth. I'm going to remove this, okay? You're also going to place your clothing protector in the laundry basket. And Mr. Patrick, I know you normally like to lay back, but I have to give your food time to digest. So for about 30 minutes, I will lower you a little, but I can't lower you flat until your food has digested. Are you okay with that? Take off your gloves. Dispose of your gloves in the trash can. Make sure that you lower the bed. If you raise it to a working height, raise the side rail back up. Leave your resident with the call bell. Don't forget to document. For the state of Florida examination, food intake is documented in percentages in increments of 25. And so he didn't eat none, he didn't eat 0, and he definitely didn't eat 50%. We document 25%. All right, everybody, this again is Nurse Eunice with Florida Training Academy. We hope that you're able to feed someone safely. Don't forget that after you feed them, don't lay them all the way down immediately. Give that food time to digest, so about 30 to 45 minutes later, you can come back and lay your patient down. You know our closing techniques. Open up the curtain, wash your hands, document, check on your patient, make sure they have the call bell. Bye, everybody.